Do you want to speak first, Minister?
I think that's
right. Certainly. Minister.
Right? That's okay.
Minister, yes, you have the floor.
Thank you very much, Gael. Can I begin by congratulating you on your elevation to even higher office and wish you well. And I'm really delighted to be back here in Seanad Éireann today to speak about my priorities for health and advancing the programme for partnership government's commitment in the first 100 days, and indeed hearing the priorities of senators. I'll be here for most of this debate, and then you'll be joined by my colleague, Minister Marcella Corcoran-Kennedy as well, who's leading the health promotion and public health promotion section of the Department of Health, and be interested in your views as well. As you know, we've made a number of commitments in the first 100 days of the lifetime of this government, and one of those commitments was the establishment of the Committee on the Future of Healthcare. And I am very grateful for the cross-party cooperation, the support of all political parties and none in the Oireachtas in terms of ensuring that this could be established without delay. The Leader of this House has already raised with me the eagerness of members of the Seanad to make a contribution to the formulation of this 10-year vision, and this is a contribution that I'd very much welcome, and whilst it's out of my hands in the sense of it is past the Dáil and a matter for the Oireachtas, but I do hope and trust that a mechanism can be found to facilitate the involvement and engagement of senators in relation to this creation of a 10-year vision. I do believe this does present us with a historic opportunity to achieve something that has never happened before in health policy, and that is a long-term consensus on its fundamental principles. I think when you talk about 10-year strategies and committees, I can really feel people audibly nearly rolling their eyes, going, another committee, another strategy. But let's be very clear, this is something we have never done before in this country. We have never before set ourselves the challenge of getting every political party and independent grouping in terms of our overall Irish Public Health Service to sign up and say, regardless of what happens in politics, regardless of the outcomes of general elections, here is where we want the Irish Public Health Service to be in the next 10 years. And if we can reach this consensus together, it will give the public, it will give the health service staff, and indeed those responsible for managing our health service, the certainty that the direction of travel won't change, even if the government does change. And that's important. When I talk to people in the health service on the front line, they say to me, we're not fed up of reform, we're fed up of a little bit of reform and then a little bit of another reform, and never actually getting to finish a process. And part of that reason is because there hasn't been consensus. Ministers for Health come and go, tweak the system, and we never actually allow enough time for a certain direction of travel to be undertaken. I do, though, want to recognise, I suppose, some concerns that have already been expressed in terms of the establishment of this committee. Firstly, people have pointed out to me that the time frame is ambitious. Certainly it is. It's a 6-month period that the committee has. But it is up to those members of the committee now to make it work. And obviously it's a matter for them in terms of how they want to order their work. Secondly, there is a key requirement to make the committee succeed is to achieve political and indeed societal consensus in the future of healthcare. I couldn't agree more with this objective. And as I've said already, it will be a significant first if we can achieve it. And lastly, I suppose, any time you talk about committees and reports, the important thing is that the process doesn't just create another report to go on a shelf, but actually leads to something tangible that we can all get behind regardless of future governments or future elections. And again, I'm fully in agreement with that view, and my department will provide every support to the committee in terms of its work, and I do intend to second somebody from the Department of Health to provide support to the committee in carrying out its work. The central objective of the new government, as reflected in the programme for partnership government, is to use our now strengthening economy to make life better for people. I heard people very clearly during the general election saying, that's grand that you've got the economy back on track, that's grand that the economy might be improving in some ways. However, what are you going to do about a range of public services? And one of those ones that I think probably all of us involved in various electoral contests heard very clearly was the importance of the health service and on reinvesting in our health service. And for me, this government's objective and my objective as Minister for Health has to be about improving the public health service that people depend on, and a health service that really matters to families and communities across the country, a health service that we will all be dependent on in our families at some stage in our lives. And we all know that the health service faces many challenges. However, I am pleased to stand here as Minister for Health to say that I am in the lucky, fortunate position, because of the work of the Irish people, to now preside over a period of reinvestment in the Irish health service. And we saw this last week with the revised estimate of €500 million into the health service. This will help stabilise our health service finances in 2016, and the HSE have already said it puts the health service on a sustainable footing. But it also gives me, in addition to that, an opportunity to address some immediate pressures facing patients, as well as meeting programme for government commitments in the first 100 days. These commitments include enabling me to put in place a winter initiative to manage emergency department overcrowding. Work is now underway on this initiative, and I met the ED task force, a task force jointly chaired by the Irish Nurses and Midwives Organisation and the head of the HSE. And at that meeting I asked them to give me their input, give me their ideas. What worked last year in the hospitals? What did they undertake last year in the winter initiative that worked? What did they undertake that didn't work? And what new things can we try? I am very pleased that the funding that I've secured for the Winter Initiative is more than last year's Winter Initiative. We've 40 million for a Winter Initiative this year compared to 33 million euro last year. And I, of course, extend the invitation in terms of ideas and input to senators in this House. Any suggestions that you think will help make our emergency departments more manageable, particularly during the winter period when we see a spike in attendances, I'd very much like to hear them. It's very important to me that this initiative focuses not just on acute hospitals, but also on effective integration between primary care, social care and acute hospital services. We have to stop talking about the issues and challenges facing our hospitals as though they're just problems in our hospitals. Part of the problem, and I know Senator Dolan here and his commitment in terms of disability work, part of it is when people who don't necessarily need to be in hospital or wouldn't have needed to be in hospital find themselves in the emergency department because they couldn't access a service in primary care or social care, and had they been able to access this, they may not have needed to turn up in an ED at the weekend, or had the support been there in primary care or social care, they could leave the acute hospital when they're clinically ready to do so, rather than finding themselves in the uncomfortable position of occupying a hospital bed when they'd much rather be at home in their community with their family. So we can't just talk about the acute hospital on its own. That's why there isn't a Minister of State for primary care, because the job of the Minister for Health is not just to be the Minister for acute hospitals, it is the Minister for all of the Irish Health Service, and that very much involves primary care and social care as well. Another integral part of the initiative that I'm able to announce as a result of the extra funding is increasing resources for home care services. As a result of this additional funding, an extra €40 million for home care above and beyond what was planned in the budget, we're not only able to maintain home care and transitional care services at the 2015 levels, but for the first time in quite a period of time, we're able to actually increase them. The programme for government acknowledges the need to improve our services to our older citizens, and the provision of additional home care services and transitional care services will assist more older people to leave our acute hospitals when they're clinically ready to do so, and this will obviously allow patients awaiting admission in our EDs to be admitted in a more efficient manner. This initiative will also, though, help older people and people with disabilities to remain independent at home and to continue to have active lives in their community for as long as possible. On this note, I do hope that you note that in terms of the future direction of healthcare and the 10-year strategy, one of the specific terms of reference is how do we ensure the effective delivery of primary care. Deputy Kelleher in the other House likes to remind me, and it's a very valid point, that when Dr. Rory O'Hanlon was Minister for Health in 1987, when I was one, he used to talk about the delivery of primary care. We're still talking now, I find myself having gone through the time that Dr. O'Hanlon was Minister for Health to myself, we're still talking about the delivery of primary care. We've got to really realise that primary care, and my colleague Senator Riley started this process, we've got to realise that primary care isn't just about buildings in the community, it's actually about being able to avail of more services in the community, and that's why I think there's an important body of work to do here. To do this, though, we're going to need to recognise that we need to build up GP capacity to respond to patients' needs and to respond to the expansion of chronic disease management in general practice. I've recently met with the NAGP and with the IMO to discuss this. I think our GPs deserve and need a new contract. We haven't had a brand new contract in 44 years. Patients in Ireland value the relationship with their GP. The state needs to value that relationship too. But also, as with any contract negotiation, the state needs to decide what does it need, what extra services or additional services or change services does it require as part of a new contract. I'm also very pleased, as part of the additional funding that I've secured, to be able to restore all of the funding to the mental health budget. As you'll know, due to time-related savings, which is a kind of very bureaucratic phrase, but due to time-related savings, some of the money that was meant to be spent in the mental health area this year wasn't going to be spent this year and would go into the base for next year. Because of the additional funding I've secured for our health service, I am in a position to restore the €12 million that had been diverted from mental health, and we will now, under Minister Helen McEntee, be in a position to spend the full €35 million that was ring-fenced for mental health services on mental health services, and Minister McEntee will be developing a plan for this year. In addition to this, we will also be able to invest further in disability services. My colleague Minister McGrath is working in this area. We have an additional €3 million for school leavers. Very important area. When people are turning 17, 18 and leaving school with disabilities, where do they go next? That worry each and every year. We have not done this well as a country. We need to do it much better. The extra €3 million will provide assistance. There's also, as part of the additional funding for disability, more money for emergency placements and for bringing disability facilities and residential services up to HICWA standards and national standards, which is important. I also want to just talk briefly, Lasca Hirlock, about the need to improve waiting lists and waiting times, with a particular focus on those waiting the longest. I think it's fair to say, as a direct result of the years of economic recession, we are seeing unacceptably high waiting lists in this country. We will be reactivating, or revving up perhaps, the NTPF. The programme for government commits to providing €15 million funding to the NTPF for an initiative targeted at those waiting the longest, from a continuing investment of €50 million per year to reduce waiting lists. I met the NTPF yesterday. I've said to them, what can you do with 15 million? How many patients can that take off a list? How will you decide who to take off a list? What could you do with more than 15 million euro? And we're having a discussion now about how best in the Department of Health to spend the 50 million euro that has been pledged in the programme for government in terms of waiting lists initiatives. We're also planning this year, in 2016, a specific dedicated waiting list initiative through the NTPF focused on endoscopy. And I expect this to be in a position to carry out at least, probably slightly more, but at least 1,200 endoscopy procedures and to clear those lists for people who are waiting 12 months or longer. This is an important issue and it needs to be addressed, and I expect to be in a position to formally bring you details of that quite soon. I also, though, just let's get here, like in summary, want to acknowledge that the health service has been changing. And it would be wrong not to acknowledge where success has happened. I think we've got to challenge ourselves. At what point did we decide it was acceptable for the political and media norm to be that we only ever talk about the Irish Health Service in the negative? I think that does a huge disservice, not just to any government or any successive government, but to the 105,000 people who work in the Irish Health Service. Every day, good things happen in the Irish Health Service. It's rightly our job to challenge things that don't go well and to highlight problems, absolutely. But I want to just acknowledge the good work that has been carried out in difficult circumstances by frontline staff over the last number of years. In this country, we've seen life expectancy in Ireland increase by 2.5 years since 2004, now above the EU average. We've seen a decrease in the average length of stay in hospitals. We've seen significant progress in reducing tobacco consumption, and I think it's fair to say that Senator Riley, in his time as Minister for Health, continued the good work of previous governments in driving this agenda that has Ireland leading Europe in terms of tackling tobacco consumption. Progress has been made in many health areas, including how we deal with our cancer patients, how we deal with cardiac situations, and it is important to recognise that progress along with recognising those who work so hard at the front line. There is clearly much more to do, but I do genuinely believe that there now exists a real opportunity to make realistic and achievable improvements to patient care and therefore make a difference to people's lives. As well as the shorter-term initiatives I've already outlined, I'm determined that we progress major investment projects like the National Children's Hospital, like a new national maternity hospital. I was in this house last week talking about this, that we look at how we can keep our population healthier through the National Obesity Strategy and the new National Cancer Strategy. But I want to be very clear, I stand here as Minister for Health knowing that I alone will not fix the Irish Health Service, and that whilst this Oireachtas is very diverse, a diverse Oireachtas need not be divided on every issue. If we're honest with each other, and I know sometimes for political reasons we like to extenuate and highlight our differences, there's an awful lot that we agree on across the Oireachtas in terms of the direction of travel for our Irish Public Health Service. There'll always be things we don't. And I think if ever there was a unique opportunity to try and put in place that 10-year vision, I think we can do it now, because we have a minority government, we have no monopoly on wisdom or monopoly on mandate, and I am very much in the hands of the Oireachtas, both in the Seanad and the Dáil, in terms of how we can work collectively together, and I look forward to working with senators on all sides of the House.
Thank you, Minister. Senator Dr. Keith.